In this video, we will see the introduction to the routes of drug administration. The routes of drug administration is broadly classified as systemic and local. Systemic is further classified into enteral and parenteral. We will be seeing in detail about the 4 parenteral routes of drug administration like intradermal, subcutaneous, intramuscular and intravenous. Before starting any procedure, we will follow the 6 steps of hand hygiene. This is done using an alcohol-based hand rub. After that, we will disinfect the area to be injected using spirit and a cotton ball soaked in spirit. The method of disinfection will be shown in further videos. After that, we will wear the gloves. Types of injection. These are the various syringes used for the routes of drug administration, and we'll see them one by one. First is the subcutaneous route. For this route, we'll be using a syringe called the subcutaneous syringe. It is also known as the insulin syringe. The maximal dose that can be given in this syringe is 1 ml or 2 ml depending upon the syringe used. The alternative unit of measurement is units. Typically, 40 units is equal to 1 ml. Next is the intradermal route of drug administration. For this, we will be using a syringe called as the intradermal syringe or the tuberculin syringe. The maximal dose that can be given is 1 ml or 2 ml depending upon the syringe used. The third is the intramuscular route. For this, we will be using the intramuscular syringe, and the maximal dose that can be given is 2 or 3 ml depending upon the syringe used. The fourth and the last route is the intravenous route, and it is of 2 types: IV infusion and IV bolus. First, we will see about IV bolus. There is 2 types of syringes. One is a 5 ml syringe and the other is a 10 ml syringe. We will choose the appropriate syringe according to the patient's requirements. Next is IV infusion. For this, we will be using solution, for example dextrose, and an IV drip set and venflons. There are 2 types of venflons. One is a normal venflon used in regular patients, and a butterfly venflon used in case of emergency conditions. Parts of a syringe. Before moving on to the procedure, we need to know about the parts of a syringe. The components of a syringe include the luer lock tip, calibrated barrel, flange, plunger and rubber stopper. The luer lock tip helps attach the syringe to the needle. The barrel contains the medication and has calibrations which is used for measurement. The flange helps guide the plunger as shown in the video. The plastic rod is the plunger and the black thing on top is the rubber stopper. It is used to seal the medication within the barrel. Next, we'll see the parts of a needle. First is the hub, which is used to attach to the luer lock tip of the syringe. Next is the hilt, which attaches the shaft to the hub. Then comes the shaft, through which the medication will pass into the patient, and then the lumen and the point. Then this is a plastic sheath that is used to cover the needle. The types of needles are given below. Thank you. In this video, we will see the subcutaneous route of drug administration. The subcutaneous route is a type of parenteral route of drug administration. By this route, the drug is deposited directly in the vicinity of the capillaries. First, we will see the materials required for this route. Before starting any procedure, we need to do hand hygiene. So, using an alcohol-based hand rub, we will follow the steps of hand hygiene. Once that is done, we will wear our gloves. Then, using a cotton ball soaked in spirit, we will sterilize the area to be injected. The drug to be administered should be taken, for example, insulin, And then we should choose a syringe of appropriate size, which is either a 1 ml or a 2 ml syringe with a needle which is typically 25 to 28 gauge. Now we will see the sites of administration. First, on the anterior aspect, we'll use the lateral aspect of lower part of upper arm, the abdomen in the umbilical region, and the thighs. Now posteriorly, we'll use the posterior aspect of upper arm, the back, and the lower loins. Some of the drugs given in this route are, the contraindications are. Now we will see the procedure. Before starting any procedure, you need to wash your hands, then ask the patient's consent and explain the procedure to them, reassure them if necessary, uncover the area to be injected, and using a cotton ball soaked in spirit, disinfect the area from center to periphery. Choose the appropriate syringe and the drug to be administered, example insulin. Load the syringe with the required amount of drug. Then at the preferred site, inject the needle at an angle of 45 degrees. Here we are using the lateral aspect of lower part of upper arm. Once injected, aspirate briefly. If there is blood, replace the needle and restart the procedure. If not, continue and inject slowly. Withdraw the needle swiftly and do not massage. The other possible sites are in the abdominal region around the umbilicus. You can inject 1 inch to the right and left of the umbilicus. The next site is the thighs. Check the patient's reaction and give additional reassurance if necessary. Clean up and dispose the waste according to the biomedical waste management guidelines and wash your hands. Some of the complications are given below, the most common being lipodystrophy. These are the advantages and the disadvantages. Thank you. The intradermal route is a parenteral route of drug administration. In this route, the drug is injected into the skin, raising a bleb. Now we'll see about the materials required. The materials required are the same as for the subcutaneous route. The only difference is that here we'll use an intradermal syringe, also known as a tuberculin syringe. The maximal dose that can be given is 1 ml or 2 ml. The dose for intradermal injection is usually under 0.5 ml. Next up is the sites of administration. On the anterior aspect, we'll be using the inner aspect of the forearm and the lateral aspect of the arm. On the posterior aspect, we'll be using the upper back and the lower scapula. These are some of the indications and the contraindications. Next up is the procedure. Before starting any procedure, wash your hands, then wear your gloves. Reassure the patient and explain the procedure and get their consent. Once all that is done, uncover the area to be injected and disinfect the area. We'll be disinfecting the area using a cotton ball soaked in spirit from center to periphery as shown in the video. Then choose an appropriate syringe and load it with the required amount of drug to be administered. For example, lignocaine. Place the needle almost flat against the patient's skin at an angle of 5 to 15 degrees. Insert the needle so that the point of the needle can be seen through the skin. Inject and do not aspirate. Watch for a small bleb to appear. Then slowly remove the needle and do not massage the area. Take a marker and circle the injected area and write the name of the drug, date and time of injection. Once that is done, give additional reassurance to the patient if necessary and properly dispose the syringe and needle according to the biomedical waste management guidelines. Then observe the area for signs of a reaction at regular interval and wash your hands. These are the advantages and the disadvantages. Thank you. The next parenteral route of drug administration is the intramuscular route. In this route, the drug is injected into one of the large skeletal muscles like deltoid, triceps, gluteus maximus and rectus femoris. The materials required are an alcohol-based hand rub, spirit, cotton ball, gloves and an appropriate syringe which has a maximal dose of 2 ml. And the drug to be administered, for example hepatitis B vaccine. Sites of administration are: on the anterior aspect we will be using the upper part of the arm, the deltoid region, and on the posterior aspect we will be using the lateral outer upper quadrant of the gluteus maximus. These are some of the indications and the contraindications. Next up is the procedure. Before starting any procedure, wash your hands, reassure the patient, explain the procedure and get their consent. Then uncover the area to be injected. In this case, it is the lateral upper quadrant of the major gluteal muscle. Then disinfect the skin. Tell the patients to relax the muscle. Choose the appropriate syringe and load it with the required amount of drug to be administered. Insert the needle swiftly at an angle of 90 degrees. Then aspirate briefly. If there is blood, replace the needle and restart the procedure. Then inject slowly. Withdraw the needle swiftly and press sterile cotton and gently massage. Since it's a sensitive area, we will usually ask the patient to massage, or else we'll get the consent of the patient before massaging. Then check the patient's reaction and give additional reassurance if necessary. Clean up and dispose the waste safely and wash your hands. These are the complications. The advantages and the disadvantages are given. Thank you. In this video, we will see about the intravenous route. In this route, the drug is injected as a bolus or infused slowly over hours in one of the superficial veins. Now we will see the materials required. The materials required are as follows: an alcohol-based hand rub, spirit, cotton ball, gloves. In IV route, we will be using a tourniquet to be able to access the vein better. IV route is split into two types. First is the IV bolus, for which we will be using two types of syringes, a 5 ml syringe and a 10 ml syringe. Next is IV infusion, for which we will be using solutions like dextrose or pantoprazole. Then we will be using an IV drip set and venflons. There are two types of venflons, a regular venflon and a butterfly venflon for emergencies. Sites of administration. The most common site of administration is the dorsum of the hand, wherein we will be using the dorsal arch veins. On the lateral aspect of the forearm, we will be using the cephalic veins. The next most common site is the cubital fossa, in which we will be using the median cubital vein. In conditions wherein the upper limb veins are inaccessible, like in burns, we will use the lower limb veins. The most common sites are the knee and the ankle, wherein we will be using the saphenous vein. The drugs given in this route, these are the indications and contraindications. First, we will see the IV bolus route. Before starting any procedure, wash your hands, explain the procedure to the patient and get their consent and reassure them if necessary. Once that is done, uncover the area to be injected completely. We should tie the tourniquet above the area to be injected. In this case, since we are using the median cubital vein, we will be tying the tourniquet in the area above the cubital fossa. Look for suitable vein. Once that is done, disinfect the skin with alcohol wipes. Then, stabilize the vein by pulling the skin taut in longitudinal direction by the other hand. Then choose the appropriate syringe and load it with the required amount of drug to be administered. Insert the needle at an angle of 25 degrees. Puncture the skin and move the needle into the vein. Make sure to hold the syringe and needle steady. Aspirate briefly to check if it's in the vessel. Then loosen the tourniquet and inject slowly. Check for pain, swelling and hematoma. Then withdraw the needle swiftly and press sterile cotton onto the opening for a few seconds and fix it with adhesive tape. Once that is done, clean up and dispose the waste safely and reassure the patient once again if necessary and wash your hands. Next is the IV infusion. First, we'll see the parts of an IV drip set. The components of an IV drip set are as follows. First is the piercing pin or the bag spike, which is used to attach to the IV bag. Then comes the drip chamber through which the drug flows before going into the tubes. It acts as a pressurizing chamber. Next is the roller clamp, which is used to regulate the flow of fluids. This is the injection port. And the needle end, which is used to attach to the venflon. This is the IV drip stand. Now we'll see the parts of a venflon. There is a lower lock plug, flashback chamber, needle grip, luer connector, injection port cap, valve, the catheter hub and wings, then the bushing, the catheter and the needle. Now we'll see the procedure. First, wash your hands, reassure the patient, explain the procedure and get their consent, and then arrange and inspect the integrity of the equipments. To do that, we need to set up the IV drip set. We'll set up the IV drip set by the following method. Choose the appropriate solution to be administered and hang it on an elevated stand. Then, using the bag spike in the IV drip set, insert it into the appropriate port given in the IV bag. Make sure the drug flows into the tube and remove air bubbles using the roller clamp as shown in the video. Once that is done, we need to choose the appropriate vein in this site to be injected. Then tie the tourniquet. Here we are using the cubital fossa for convenience. In an actual patient, we will use the dorsum of the hand. Then disinfect the skin over the vein with sterile cotton soaked in spirit. Stabilize the vein by pulling skin taut in longitudinal direction by the non-dominant hand. Then insert the needle at an angle of 25 degrees. Puncture the skin and move the needle into the vein. Make sure to hold the syringe and needle steady. Aspirate briefly. Then remove the tourniquet. Make sure the venflon is stable at all times. Then stabilize the venflon using a micropore tape. Once the venflon is stable, insert the IV set connector into the cannula. Open the clamp and adjust the flow rate as per prescription. Then check for pain, swelling and hematoma at the site of injection. Once that is done, paste a tape with the date and time of the initiation of the IV. Once that is done, remove the gloves, wash hands and dispose the waste appropriately according to biomedical waste management guidelines. These are the complications, the advantages and disadvantages. Thank you.